You're listening to Be Health Connected, a podcast by the St. Louis Area Business Health Coalition. Your host for today's episode is Annie Fitzgerald, BHC Director of Member Engagement and Health Solutions.
Hello, I'm Annie Fitzgerald, and welcome back to the BHC's Be Health Connected podcast. In today's episode, we're shedding light on a topic that impacts countless women's lives and the workforce at large: menopause in the workplace. Our distinguished guest today is Katie Schubert, who assumed the role of President and CEO at the Society for Women's Health Research in April of 2020. Katie, thank you so much for being here.
Thanks for having me.
Yeah, of course. We're excited to bring this important topic to our employer members. Can you provide some context for our listeners about the significance of menopause and its impact on women's lives in the workplace?
Absolutely. And this is a really important topic, I think, for employers in particular, as they're thinking about supporting their employees at a really critical time in their lives, but also more importantly, in their careers. So all women go through menopause at some point in their lives, but every woman is going to experience menopause very differently. An estimated 6,000 women reach menopause each day, and 1/3 of a woman's life in developed countries is actually spent beyond menopause. So 51 years old is the average age of menopause for women in the United States, and that varies sort of across the globe, and there will be different individual impacts depending on sort of what your healthcare looks like, but also your background. Everyone's a little bit different. And I think just to put it in the broader context of the workplace, 44% of women in the workplace are older than the age of 45. So many women are actively working during their menopause transition, and obviously for many, many years beyond that.
And you kind of teed it up a little bit, but can you talk a little bit about how menopause affects women, physically and psychologically, and really why it's important to address these effects in the workplace?
Yeah, some women transition to menopause with very few symptoms. As I said, they may not even fully know that they're in the menopause transition, but others may have a variety of symptoms. They may come and go. They may have symptoms that persist or really are quite bothersome. And this goes far beyond what we might typically think of as menopause symptoms, like hot flashes. Most people think it's just, you get a little warm and it's a little uncomfortable and that's it. But there's a lot more to it than that. And I would also say that menopause is not a disease. It's a natural part of aging. And so this transition can impact all aspects of a person's life. Like I said, beyond hot flashes, it can include sleep patterns, your bone health. A woman's risk of osteoporosis increases after the menopause transition. Your heart health may be impacted. The menopause transition also creates an increased risk of cardiovascular disease, weight gain, digestion, hair growth, cognition, which is a huge issue. Brain fog has been a part of this discussion for quite some time. So really impacting that cognitive factor, mental health, and cancer risk. So there's a lot of different ways that we can look at this, but I would say it is a universal life stage for women and encompasses so many different physical and psychological symptoms that really it can't be ignored within the workplace. Ignoring it results in things like absenteeism, productivity losses, and a lot of these things could be addressed pretty easily with a conversation, with having an open dialogue about this. And the last thing I would say is that there's an estimated $150 billion in menopause-related productivity losses worldwide every single year. That's a huge number. And so menopause management at work is really an issue we should all care about, both from a healthcare perspective, a productivity perspective, but quite frankly, from a business perspective.
Certainly, and I think we've kind of teed up the issue here nicely, and I think for some employers, and especially those that we work with at the Business Health Coalition, there's so many different things that they could be focused on, when trying to improve the lives for their employees, and so oftentimes they're really looking for an expert in certain areas that they can lean on. So could you tell us a little bit more about your work with the Society for Women's Health Research? research, in the area of menopause or even just women's health as a whole, just to, give employers a sense of, the ability that you all have to kind of be that organization that they can maybe lean on for this research?
Absolutely. So it's really important, I think, to think of women's health from a health span approach, right? All the way across your life. We used to call it from womb to tomb. That may sound a little bit crass, but it is true, right? You want to really think about this from all of the different stages of your life that you might have health issues, but also how to remain healthy and live well. So SWHR was founded in 1990, and our mission is to promote research on biological sex differences in disease and improve women's health through science, policy, and education. We have had an active menopause program for the last 3 years, but we actually started our menopause work much further before that. We had one of our very first scientific networks was focused on hormonal changes and really looking at the menopause transition of life as well. But in the summer of 2022, we published a pretty comprehensive and completely free menopause preparedness toolkit. It features information about the menopause transition, symptom management, a little bit about workplace wellness, and then general women's well-being tips. And we also released an accompanying video series that reviewed the same topics as the toolkit. So a couple of different ways to take a look at what that looks like. And then in 2023, after hearing more from our working group, women at large, and really thinking a lot more about this issue, we began our Menopause in the Workplace program. We wanted to collect resources. We wanted to fight stigma about healthy aging at work. And we started that through a menopause and work study, which we're currently reviewing the data from. And we will release after that an employee and employer menopause workplace wellness guide a little bit later this winter.
Yeah, that's amazing. And we're eager to see the results of that, and knowing that, kind of targeting the workplace, I think is really smart, because, with individuals working 40 plus hours a week, you really have a captive audience, and employers truly do have the opportunity to impact the well-being of their employees. And so, we've kind of talked a little bit about the survey. Could you give us a sneak peek into some of the key study findings, and maybe some insight into what prompted you all to undertake this research?
Yeah, I think this is a really important survey and a really important results from the study that we're finding. And we really wanted to, again, continue to support women during their midlife and during the menopause transition with the understanding that from an employer perspective, it's really vital to retain talent and foster career growth. So wanting to help better understand where those support systems need to be built and what they need to look like and how we can best sort of provide some information for folks to be able to have these conversations. Overall, our study results have revealed, unsurprisingly, that menopause has greatly influenced women in making career-related decisions. And I think sort of the more surprising part of this was really thinking about the greater, broader impact of that, right? We knew anecdotally that women were leaving the workforce or reducing their hours or making other types of changes. The question really was, what does that mean? And so a lot of those, the sort of influence here and what this means is that they're not pursuing leadership opportunities. They are reducing their workloads. They're thinking about job changes, and many of them are thinking about things like self-employment. And frankly, they're considering leaving the workplace altogether. We found a lot of information surrounding employers having a desire to be supportive of women at this stage in their lives, but not really knowing how to do that. So I think that's a great place for opportunity here. And then really thinking about how can we support the employees in this journey. Many women found that once they were through the menopause transition, they understood that that's what was happening, but they did not necessarily understand it while they were going through that transition. So things like brain fog and cognitive function, like I mentioned, sleep disruptions, they maybe were thinking something else was going on, and actually it was the menopausal transition. So sometimes that just makes you feel better, right? To know that, okay, this is something that is a normal life stage. There are ways to be able to address it, but they didn't quite know what was happening beforehand. And that really did lead to some career decision-making on their part.
Definitely. And I think, in a lot of ways, just simple awareness can make such a big impact, and help women recognize that their symptoms might be related to menopause and not something else. I think something that else comes to mind is, employers that offer something like employee resource groups. Could they offer, a women's health employee resource group that has these open discussions to make, women feel like they're not alone and kind of have that support system that they can lean on. So really eager to see the results of the survey and, certainly bring those learnings back to our employers. Besides kind of what I initially talked about with the employee resource groups, are there any other strategies that you're currently, recommending that employers or supervisors could implement to create a more supportive workplace environment for midlife and most kind of post-menopausal women?
Yeah, absolutely. So I think opening up the conversation, for one, is going to be a really critical piece here. And there's a big area of need. And I think the other piece is getting more education on menopause, right? Both for the employee and the employer, and thinking about how to have that conversation. So we know that it's important to increase the visibility of diverse experiences of women during and after that transition. And our study found that supervisors who were more familiar with menopause were more likely to have actually participated in open conversations about menopause at work. So really that comfortability of that. I think the dialogue piece is key. I love this idea of employee resource groups so that you do feel that you're not alone and you can have that conversation. There's also power in numbers there too, right? If you can see that topic rise to the top within management, you can actually work to address some of that work versus someone thinking it might just be an individual issue that they're experiencing. And so for our study, we also saw that a majority of supervisors indicated that menopause-related training and workshops, so again, more education and awareness would be valuable, and that would be a really interesting way to spend company resources to support employees. And so I think the interest is there. We just need to find the space and create those resources. So all of this will lead into this guide, as I mentioned, that will create that support, both for women in the workplace, but also how do you as an employer start this conversation? Is it a matter of accommodations? We hear a lot about like cooling rooms or fans. Those are all really important, but it may be just a matter of, quite honestly, saying, I didn't get any sleep last night because it was so disrupted and I might need some time. Some of these other issues in companies where you are not traditionally sitting behind a computer. So, law enforcement, healthcare professionals, right? Clinicians, healthcare support providers, teachers, right? Folks who don't have that luxury of being able to say, I'm just going to need to take a day, or I'm going to go off camera or work from home, really thinking about how we can support them as well to open up the conversation and see what makes sense. Starting the conversation is the most important thing, but I think beyond that, really thinking about what is of value to those going through the transition so that they feel well supported.
All of that again sounds great, and we're looking forward to seeing the guide. In the meantime, I think it's worth noting that October is Menopause Awareness Month. Do you currently have any suggestions on how individuals, organizations, or really just society as a whole can contribute to raising awareness about menopause and its effects on women, both in their normal life as well as in the workplace?
Absolutely. So Menopause Awareness Month, we're really excited to be recognizing it this fall. I think we are seeing a groundswell of conversation and support to talk more openly about this transition and to really come together and find some solutions to addressing this topic. So one thing that we really think is important at SWHR is just talking about it, right? Having more conversations like this, break down the stigma. One thing that we do is we encourage people to share their own health story where and when they feel comfortable. Those firsthand accounts can make real change in healthcare research and care access within policy. And that means, within your family, in the workplace, with your friends. A lot of women aren't necessarily talking about it, although I would say, I think for younger generations, they're really talking about their healthcare a lot more. And so I think that's only going to help this conversation further. The other things that we can do is think about sharing your story within the context of menopause, and what does that journey look like? Did you realize you were in this transition? Did you have conversations with your clinician about it? many clinicians may not be as educated on menopause as you might think. So really being able to come to your medical appointments and asking questions about it and seeing if there are other resources available for you. And then I would encourage folks to just read up on menopause, right? You can read our materials from SWHR. There's a lot of other great organizations like the National American Menopause Society, Red Hot Mamas, Let's Talk Menopause, Black Women in Menopause. There is a group out there for everyone. And we have a really exciting, again, free public webinar coming up actually at the end of this month with some United Kingdom policymakers who have done incredible work to get menopause workplace guidelines in place over there. So we're hoping to understand what we can learn from them and bring those policies here where they make sense. So there's more information about that on our website. It'll be recorded, it'll be shared afterward. But I think, again, this groundswell of conversation is going to be really important as we recognize Menopause Awareness Month.
Well, we look forward to supporting those efforts. Katie, it's been so nice to have you today. Any final thoughts or, ideas as to how listeners could maybe support the work of the Society for Women's Health Research?
Absolutely. Please follow us online. Go to our website, swhr.org. We are on all major social media channels as well. We have a monthly newsletter that you can sign up for as well that really tackles women's health, again, across the health span, but a lot coming on the menopause topic in the near future. We have public webinars, new resources coming out all the time for women, clinicians, and policymakers. So there's lots of opportunities to engage either in advocacy for yourself or sort of more broadly within the federal policymaking arena or even within your company. And if sharing your story is of interest, we would encourage you to please share your story with us. We're always looking for those personal health journeys, and that can be shared directly with us at our website, swhr.org/share-your-story.
Well, that's wonderful. And hopefully we have some stories to share. And we'll certainly, like I said, have the menopause in the workplace survey results and guides shared with our members as well as our community partners through our own channels. So Katie, again, thank you so much for joining us today. This has been really wonderful and I think a great introduction for our employers and our community partners. We look forward to staying connected with you and the Society for Women's Health Research to really bring this topic to the forefront for our community.
Thank you so much. We need everyone out there really contributing to this work. So this is really exciting to see.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the St. Louis Area Business Health Coalition, please visit www.stlbhc.org.